Hi, it's the nursing professor back for a new semester, and so this video we're going to talk about 5 tips I have for you new students who are coming into the nursing program. So these tips are going to help get rid of some of that nervousness that I'm sure you have going on, anticipating what's going to happen this semester. All right, so 5 tips will be: first, medical terminology. You can start that now. Go and look over your medical terminology terms. The next would be anatomy and physiology. You need to know where those body parts are so that you know what the teacher is talking about. The next will be metric conversions. Fourth will be dosage calculations. And last but not least is to have the confidence that's necessary for you to be able to be successful in your nursing program. So in this video, I'm going to start out by giving you some medical terminology that you should know. All right, so vital signs. What are vital signs? Vital signs mean that you're talking about blood pressure, heart rate. Heart rate is the same as your pulse. All right, respiratory rate and temperature. So you're going to be asked to know what that means, what those normal values are. All right, including your oxygen saturation, which is a pulse ox machine that most of us are familiar with. When COVID happened, we had these little machines that we could test how much oxygen was in our bodies. All right, so next for medical terminology, we're going to look at level of consciousness. So what the heck does that mean? Frequently, you'll hear the term alert and oriented times 4. That means that person is alert and oriented to person, meaning they know who they are, where they are, place, what time it is, have some idea if it's day or night, and the situation at hand. Like they can say to you, I'm in the hospital because my throat hurts. All right, then you're going to make sure you understand a baseline assessment is necessary in order for you to be able to do comparisons. So you do an assessment first, you find out what is normal for that patient, and you have something to compare it with. Now, these are some common prefixes and suffixes that you should be aware of, and this is really going to help you out a lot. Tachy means fast. Brady means slow. Hypo means low. Hyper means high or above normal. Itis means inflammation. And ectomy means removal. So frequently you'll hear of ectomy if somebody had a particular type of surgery. All right, so here's some other abbreviations that you should know. PRN, which means as needed. BID, TID, and QID. Frequently used, BID stands for twice, TID stands for 3 times, and QID stands for 4 times daily. When we say PO, we mean by mouth. Can somebody take something by mouth? Do they have any difficulty swallowing? We also administer meds IV, IM, sub-Q. All right, so intravenous means through the vein, intramuscular means through the muscle, and subcutaneous means through the fat of the body. All right. So other terms you need to know is adverse reaction. That means it's unintended. We don't want that. Contraindication means reasons not to give the medication or treatment. So you should know those. And then we should also know words associated with safety and infection control, like standard precautions. This is where you're treating everybody as though they are potentially infected. You're not looking at somebody and say, oh, she's cute, so she doesn't have anything. No, everybody's treated the same way, as though they have an infection. Transmission-based precautions include contact, droplet, and airborne. So you need to know those. Aseptic techniques means preventing contamination. So that's like your hand washing. PPE would be personal protective equipment. That's going to be like the gloves. You don't touch blood or body fluids without having on gloves. Isolation means your person has some sort of infection. You definitely don't want that to spread, like COVID, for example. And you're going to separate that person by having that person in a private room. All right, so moving on, here's a few more clinical terms I want you to know. ADLs. That means activities of daily living. That means that person can feed themselves. They can wash their bodies. They can brush their teeth, things like that. Ambulate means to actually walk or move. Can your person do that? Acute versus chronic. Acute means sudden, short term, like somebody has a cold, versus long term might be something more like a person has arthritis, or a person has congestive heart failure, and you'll learn all about those terms. But you should be able to start studying what it means acute versus chronic. Edema, that's another word for swelling. Dyspnea is another word for difficulty breathing. So that could look several different ways, but knowing these words are really going to help you understand those lectures. Cyanosis means that the person's skin is bluish or gray even, which is an indication that they have a low oxygen level. Few more words. I know I just said that before, but really a few more words. Lateral means that person is on their side. Sims mean that person is on their left side. So think of how you sleep at night. You move from one side to the next. Prone means that you're face down. All right. Supine means you're face up. Abduction, I remember this by thinking of when we hear of a baby being abducted. That means that they have been taken away. So abduction means that you're moving something away from the midline, whereas adduction means that you're moving something towards the midline. Knowing the differences between the two of those are really going to be helpful to you as you listen to lectures, as you read the textbook. Things will make a whole lot more sense. So I hope that's helpful. Now remember, you have 4 more. That's just one tip. So I want you to subscribe, like, and share this video, and stay tuned for the next 4 tips I have for you in order for you to be successful in your first semester in nursing school. I'll see you next video. Bye for now.